Yeah, I'm just streaming this live. Yeah, now it's live on YouTube as well.
Okay, great.
Yeah. Yeah. So good evening, dear students, faculty who've joined us here for yet another session of PhD 101 National Rapid Revision webinar series. Now, the National Rapid Revision series has been going on for almost more than a year now, and we've been getting very good response from students. The best part about this happens to be that different students from various parts of the country, they have an opportunity to learn from faculty from different colleges spread across the country. So this actually facilitates a very enriching learning experience. And in continuation with that objective, today we have with us Dr. Vineet Vinay. Now, Dr. About Vineet, just a little bit of introduction. Dr. Vineet is presently working as assistant professor at the Department of Public Health Dentistry, Srinagar Dental College and Hospital, Pune, India. He also has multiple profiles in various domains, and I think I can vouch and say on behalf that someone who is really dynamic and who has explored various domains of public health dentistry post the completion of his PG. So as we know here, today we have very important topic of planning and evaluation, which is very central to the understanding of dental public health, the various programs, and the workings of how community oral health services are being delivered across the country. Now, Dr. Vineet is again, a long list of achievements, but let me just be quick and give a gist of what he actually works, predominantly in domains of research, a number of, plenty of publications and a lot of awards and recognitions which he's got. And he's also been into a lot of active community services, planned and organized and mobilized various programs. And then his special keys areas of interest include research and biostatistics. So he's very well versed with most of the softwares, and he is known for his statistical consultation, and accordingly also has been conducting various workshops in this regard. Now, about the various positions held by Dr. Vineet, of course, apart from working at Srinagar Dental College, he's also research faculty under the MUHS Nashik, Maharashtra. A state dental council accredited speaker, an expert reviewer at the LexCode Journal Lab, Philippines, the assistant editor at Dental Mammoth based in Finland, and consultant statistician for Skinovate Pune and iLife based in Bangalore. Coming to his academic history, he holds various certified degrees from in the field of biostatistics, epidemiology, and research math from the Indian Bioscience and Research Institute, Noida. Also a course on health research fundamentals from the National Institute of Epidemiology, ICMR, and a Life First Tobacco Cessation training program. And I'm really glad to say that he has completed his master's in dental public in dental surgery, that is public health dentistry, from Bharati Dental College in Bangalore. Now, coming to his awards and recognition, I really don't want to go in detail because he's a very clearly identified speaker in domains, and someone I really appreciate that he's been doing such phenomenal work in bringing together a lot of student community and actively mobilizing them. So I would say, more of less of theory and more of practice is what he stands for. So I'm immensely happy that Dr. Vineet has taken out time today to share with us his knowledge and expertise related to the topic for planning and evaluation. Now, let me inform all of you students who are attending this that this will be a quick rapid revision so that you can quickly revise all the basics. It will be an overview only. Of course, if you need any more additional information, we'll be more than happy to provide that. And with that background, I think I welcome again Dr. Vineet to the panel, and welcome to you, Dr. Vineet.
Thank you so much, Dr. Denzi, for such a wonderful introduction. And thank you for inviting me, and thank you for making me interact with these students who are preparing for their exams. And it is an opportunity, a one-time opportunity. It's a lifetime opportunity for me to interact with these students. And thank you very much for involving me in PhD 101. And it is really a pleasure and honor for me. And you are really conducting a wonderful sessions like this, different topics on public health dentistry, and you are raising public health dentistry at the next level. It's just because of you that people are getting known about public health dentistry more and more, and giving me a chance is I'll try to make it a good one. Okay, Okay, fine. Let's not waste much of time, and then we'll start with the topic, planning and evaluation. Okay.
Yes.
So good evening, everyone. Have a wonderful time. Have a nice time. I'm Dr. Vineet Vinay. I'm from Department of Public Health Dentistry, CA Dental College and Hospital. Okay. Now, planning is something which we do every single day. You know, we are going to plan something today. Okay. Or, New Year resolution is a plan. Everybody makes a plan. Okay. So basically, we are going to tell you, I am going to tell you what planning means in a community level. Whenever you conduct a camp or whenever you want to, reduce the disease burden in the society, in the community level, or in the state, or in a country, you need to plan the procedure. Everything is called as planning. So it's not like a day-to-day planning, like you change this or again you change, or you want to lose weight and then you have forgot, you do exercise or you do dieting for a day or two and then you stop doing that and again you'll plan, okay, next year I'll start gymming, next year I'll do my diet control and all those things. So this is different because this is going to help a lot of people in the community, in the state, in the country because of your plan. So your final year videos, you have a question on planning and evaluation. It can be a direct, full, long questions or short questions, depending on the university which you are attending. So you can have a direct question on planning as well as evaluation, and they might give you a scenario in which you have to plan a program, how to reduce the disease burden in the community, probably in a village or in a city, where you plan and how to execute, and all those procedures will be included in the planning. So I'm going to talk to you about planning and evaluation. Now, before that, let's make it a little interesting. Now, you know this place, right? Everybody knows this place. Can you put up in the chat box if you know the place?
Yes, yes. Come on, students. I think we want this to be a little interactive. So
because I want to
yes.
make it a little interesting, then only you will understand what is planning and evaluation. So kindly put up in the chat box, do you know the place?
Yes. Yeah, we're getting the responses.
Yes. Now, everybody in their lifetime, they would have planned to go to this place, right? They would have planned, let's go Goa. Okay. So out of 10 times, if you have planned Goa, hardly 90% of the time, the planning was failed. Every time you plan, something or the other comes. If you plan with your friend, if you plan with the family, if you plan with during your college days, some or the other issues will come. You'll not get the tickets, you'll not get the bookings. Your parents will not allow, daddy will not allow, or mom will not allow, or all those things. So I am going to correlate your planning of Goa to planning and evaluation in a community setting. Okay, fair enough. So we can have an interaction, what problems you face when you plan for Goa or you're planning to travel Goa. So this is what example I'm going to take in the whole procedure, in the whole session. We'll be talking about Goa and disease burden in community level. Okay. Okay. Now planning and evaluation is the topic. So we'll be covering the topic on the planning and evaluation. We'll not go very deep into it, but of course, we'll give you so much that you can write your answers in your exams. Okay, that will be more than enough. So we'll be doing planning and evaluation. The content of my session will be a little introduction with the types of health planning and steps in planning process. And I'm going to show you one flow chart. If you draw that flow chart, you are going to get full marks. If you draw that particular flow chart, and you are going to get the full marks, and little explanation about it, and you'll really score good in that particular question on planning and evaluation. Okay. That is called as steps in planning process. Then uses of planning, and then we'll go with evaluation, and we'll conclude with 3 or 4 statements. Okay. Now, why plan? Why do we want to plan something? Why do we want to go with the planning? Okay. To match the limited resources with many problems. Now, whenever you plan something, you want to conduct a oral health treatment program in your city, in your village. Now, there will be a lot of problems. Okay, so limited resources with many problems. To eliminate wasteful expenditure or duplication of expenditure, and to develop the best course of action. That is why we plan, right? To develop the best course of action. So these are the reasons why we plan. Fair enough? Now, planning is an integral part of healthcare provision. Now, because of the COVID situation in India, the government had to make a lot of plans. As simple as that. Now, planning started with oxygen cylinders, or different remdesivir injections or different drug injections uh, for COVID treatment, and then the vaccine planning for the vaccine. They started with 45 years and more. They started with frontline workers first, then 45 years and more, and then they're going with 18 to 44 years. So all these is a part of planning. So in a healthcare provision, we have planning is an integral part. Okay. And decisions are made in the best manner to reach the desired outcome. So if they want to succeed in vaccinating everybody in India, they have to plan. So that is why the government is doing that. Okay. Planning provides a guidance structure to the process of decision making to maximize results. If you are not planned, if you don't have a step-by-step procedure, if you don't know what to do next, then you are not going to get a proper result. So to maximize result, you should plan, basically. Okay. So according to E.C. Banfield, the plan is a decision about course of action. Whatever you are going to do, whatever is the course of action is called as a plan. Okay. So defining the problem, setting the priorities, developing specific goals and objectives, and determining alternate strategies and then methods of implementation. This is called as planning. Okay, this is the core thing of a planning, the core step of a planning. Okay, systematic approach to defining the problem, setting the priorities, specific goals and objectives, and alternate strategies or alternative strategies and methods of implementation. Now, there are various types of health planning given by Spiegel. The first one is problem-solving planning. For an example, you can see a lot of sectors in India, a lot of states, a lot of areas in India are they have dental fluorosis existing. Okay, so you have to identify and you have to find the resolution of the problem. That is called as problem-solving planning. So any planning done to solve a problem is called as problem-solving planning. Then program planning, design a course of action for a circumscribed health problem. You want to conduct a fluoride rinse program, in a school-based situation for dental caries. That is called as a program planning given by Spiegel. And then coordination of efforts and activities planning. Okay, aim to increase the availability, efficiency, productivity, effectiveness, and other aspects of activities and program. Example, closing of obstetric and pediatric wards in hospital located in area with declining birth rate. So that is, you are aimed to increase the availability. Okay. Now, the last one is planning for the allocation of resources. Now, you have an amount, the government has given you an amount, or your institution or your association has given you some amount of resources that can be in a form of a manpower, it can be in a form of a money. So you are planning for the allocation of resources, what, where, how to use what. All those things will be coming in this. So selecting best alternative to achieve a desired goal when the amount of resources is limited. For an example, pit and fissure sealant programs instead of fluoride mouth rinsing programs in area with high prevalence of pit and fissure caries. So it's always better to do a pit and fissure sealant program if there are a lot of pit and fissure caries. Okay, instead of going with the fluoride mouth rinsing program in that particular area. So that is called as a planning for allocation of resources. Okay. Now coming to the steps of planning process, I'll show you a flow chart. Try and understand that flow chart and you will understand everything about planning. First, identify the problem. Okay. Now you're doing a community-based program. You have to first identify the problem. For an example, let me say it's Mumbai. Okay, in Mumbai, when you find the problem that a lot of school children are suffering with dental caries, now that is a problem. So you have to identify the problem first, and then only you can go with the other steps. So first step is to identify the problem. Now, after identifying the problem, you do need assessment. You have to conduct the need assessment, whether there is a need of any program in Mumbai schools or among school-based children. Collect the data. How many kids are suffering with dental caries? How many have initial dental caries? How many have deep, or they have more cavity or destructed enamel, or following dentine, or going to the pulp. All this data has to be collected, and then you are going to analyze the data. After doing all these three processes, you are going to set your priorities. You have to determine the priorities. Do you want to do a program to remove dental caries, or do you want to conduct a program so that dental caries doesn't occur itself? Or do you want to target those individuals who have extensive dental caries, who are, the DMFT score is more than normal, more than 2 or more than 3 or more than at particular level? You have to decide that. That is called as determining the priorities. Okay. Then coming to, after determining the priorities, you will develop program goals, objectives, and activities. What is your goal? What is your short-term goal? What is your long-term goal? You want the caries to be reduced in 5 years. You want the caries rate reduced after 10 years. That is what you determine goal. And then among that will come objectives and activities, what you are planning to conduct. Then you have to look at available resources. What all resources you have, whether you have appropriate manpower, you have appropriate resources or grants or money for the treatment procedure. Then you identify constraints. What constraints you are going to face? The constraints can be of any form. Probably the school doesn't want to go for the treatment, or the village or that particular sector of the politician, there is political constraint. There can be monetary constraint. There can be knowledge constraint. People are not aware of the problem. They don't want to go for the problem. They have some other issues and all those things. That is what is called as identifying the constraints. And then identify alternate strategies. If this doesn't work, what am I going to do? If I'm not able to conduct a pit and fissure sealant program in that particular school, what can be the other alternate strategies? Can I go with a fluoride rinsing program? Or can I go with oral healthcare awareness program, or just create awareness among them, something like that. So that is called as identifying alternate strategies. And then given the resources available you have and the constraints, choose those activities that will be most effective. Now you have to assess, this is the amount I have, this much is the amount I have, this much, these many people are working with me, this is the manpower I have, I have this much of infrastructure, I have this much of pit and fissure sealants, or I have this much of restorative material. Then you plan and see which is the most effective method, so that you bring some change in the community or in the school. Develop implementation strategy. What all strategies you are going to implement, you have to develop. For an example, on the first day, how many you are going to treat? On the second day, how many you are going to treat? Who is going to do the treatment? How many manpower is required for an example, 300 children are there in that school. So how much is the manpower required? That is called as developing implementation strategy. Okay, how you are going to implement your planning. And then you implement, monitor, evaluate, and revise. Now you have done the implementation. You have to keep monitoring it, whether everything is going good, whether your aim, your goal of achieving no dental caries, your goal of treating that children is going on properly or not. Is there any wastage of the material? Is there any wastage of a manpower? Is there any wastage of a money? All those things you have to monitor. Everything is going properly. And then you have to evaluate at the end. Everything is fine. Now you are out of 300 children. You have treated almost everybody. You revise if there is anything remaining. And then again, the process goes on. Again, you identify the problem, conduct need assessment, and all those procedure will start again. So that is the whole concept. And this, because this is an ongoing process. So at a community level, everything keeps on repeating. Okay, because you realize that something has been missing. Some children are not being treated properly, or some dental caries are still missing. Then you have to keep starting. You have to identify the problem again, conduct need assessment, collect the data, analyze the data, and then go forward again. Okay, fair enough. I hope you have understood. Now coming to Goa, if you have not understood this, hopefully you will understand this. Now you are planning for Goa trip. You are planning for break. You're planning for a break and you want to visit Goa. Now you have to identify the problem. What is the problem you are not able to go Goa? Okay. So you conduct the need assessment. What is the need of going Goa for you? So I want to relax. I want to chill. I want to have a break, and that is a need assessment. So I want to go to Goa. Collect data. Collect data means how much money you have. Okay. Which hotel is good? Which resort will be good? Which is a sea-facing resort? Which is close to the beach? So all these things is collecting the data. And then analyze the data. Analyzing data means, am I going to spend all my money on resorts alone? Or am I going to have, some adventure trip? Am I going to have nice food and drinks over there? All those things is called analyzing the data. Now, after doing all those things, you will determine the priorities. Determining priority means whether you are going to use all your resource or all your money into the resort itself. Like you want to stay in a very lavish resort and all those things. So whether you want to do that, you want to waste your money in the resort, or you want to waste your money in eating food, or you want to waste the money in adventure trip, what do you want to do? That is called as determining priorities. And then you develop a program, you develop everything, and you set your goals. My goal is to have an adventure trip in Goa. That is my goal. So that is what I have developed. Now, after developing a program, after developing your goals and objectives, you have to identify available resources. Available resources means whether I have a good number of friends with me. So if I'm staying in a resort, I have to, the money will be shared. If I'm staying in a room, 3 of people are staying together. So I'll be sharing money. We have to share money and put up in the resort. Then you identify constraints. Constraint means what will happen if my father doesn't allow, or if my mom doesn't allow. Okay, what will be my alternate strategy then? So I have to request my mom, I have to plead my mom, and mom is going to convince my dad, all those things. That is our alternate strategies. So till here, you have to identify available resources, you have to identify constraint, and you have to identify alternate strategies. Now, after identifying all these things, choose those activities that will be most effective. So if I go by bus from Mumbai to Goa or from Bangalore to Goa, I'm going to save money. If I stay in a simple hotel or some 1 or 2 star hotel or in a lodge, I'm going to save my money. And then I can spend my money on good food. I can spend my money on adventure trip. That will be the most effective. That is called as, your implementation strategy. So this is what you are going to do. Now you reach Goa, you do whatever you feel like doing, whatever you have planned of doing. You monitor your planning, you monitor the steps, what you have done. Then you evaluate whether I have some money left, or whether I can spend some more money on some other adventure trip. Okay, all those things, revise, and this is the whole ongoing phase. I hope you have understand this particular flow chart, and I hope you have understood the example with the Goa example. It will retain in your mind, but don't write this example in your exams. I'll show you other examples which you are supposed to write in your exams. Okay. Coming to identifying the problem. The problem is there are a lot of best things to do in Goa. I am not able to do. That is my problem. That is to identifying problem. So what is the problem? How it is defined? What are the characteristics of a problem? What are the terms and processes used to describe the problem, and why is it a problem? This is what is called as identifying the problem. For an example, dental caries in a community setting, dental caries or periodontal disease or malocclusion or oral cancer, that is a problem which you are going to, which you are going to look after when you're planning your program. Okay. Then you conduct the need assessment. Why? Why do you want to do that? To ascertain the cause of problem, to identify extent and severity of the problem. So you will go to the community, you will see what is the need, what is the need for all these things. How much is the severity of dental caries? What is the extent of oral cancer? And to evaluate effectiveness of program by obtaining the baseline information. So at that, when you do a community program, you will get a baseline information. So you conduct a need assessment to identify how many people are suffering with dental caries in that particular community. Okay, so this is a baseline value, and you are planning to go with, reducing that baseline value. So for an example, DMFT index or DMFT score is 5. Average DMFT score is 5 at the baseline. So you will conduct a program to bring it down to 2, DMFT 2, which is recognized by WHO. The DMFT value 2 is the ideal DMFT score in a country or in a setting. Okay, and measuring the amount of progress achieved in solving the specific problem. Need assessment can be costly to coordinate with research activities of other agency and to investigate past survey done. Information required in a need assessment is number of individuals, geographic distribution of the population, the growth rate, population density and degree of urbanization, ethnic background, diet and nutritional levels. All these are information required. Okay. So number of individual, geographic distribution, growth rate, population density, degree of urbanization, ethnic backgrounds, and diet and nutrition. Standard of living is required. You have to understand what is the standard of the living during need assessment itself. Healthcare facilities available also you have to determine when you are doing the need assessment. Public and private school system, general health profile, and patterns and distribution of dental diseases. This is what is required when you are planning for a need assessment, when you are going for a need assessment. Check for the history and current status of the dental program in that particular area and fluoride content of the water. So all these things, standard of living, everything has been told. These things will come under needs assessment. After need assessment, you have to go to analysis of data. Analysis of data means how much manpower you have, how much is the dental caries and how much manpower you will require, how much is the dental caries prevalence and how much resources or the material, dental material is required, restorative material is required, how much pit and fissure sealant is required. All these things is called as analysis of data. Okay. So in analysis of data, you have to look into population, cultural and language issues. Look whether people are able to understand your language. Is there any culture distribution? Is there any age distribution? Educational system is also important because you are going to conduct awareness programs. So you have to look into number of schools, enrollment and distribution of school among children within the community, and educational status of the community. If you are planning for an oral health educational awareness, or if you are planning to oral health awareness program, you have to look at what is the level of the education in that particular community. For an example, if I'm conducting a program, if I want to conduct an oral health program in a village in Maharashtra, so I have to look at the educational status of the community. I have to see what is the level of education, whether they are 10th pass or they have done graduation or they are very well educated or they are illiterates. All those things I need to see when I'm conducting a program like this. You have to look into the median income of the community. You have to look into the public transport system, healthcare facilities, fluoride content of the water, and political status of the community. Okay, because you have to understand when you are implementing something in a particular section of a society, you can include the political leaders of that particular area or the community head leaders of that particular area. So they are important. So you have to know the political status of the community. Coming to determining priorities. Now, priority determination is a method of imposing people's values and judgments of what is important onto the raw data. Now, what is a priority? What is the first thing first? What is the first thing you want to do? It's a method of imposing people's value and judgment of what is important. So you have to find out, you have to ask, you have to see how serious is the problem. Now, if we, for an example, if there is something, you have dental caries, you have oral cancer together, in our community, there is a lot of people suffering with dental caries. There are a lot of people suffering with oral cancer. You have to determine which is a serious problem. How serious is that? And on the basis of that, you have to design a program. You have to make a program according to that. And what you have to look at the percentage of population affected. So you have to see what is the percentage of population affected with oral cancer, what is the percentage of population affected with dental caries, and on the basis of that, you have to conduct a program. You have to look at the high risk, which are the group of individuals who are at high risk. So basically look for preschools and school-age children, mentally or physically disabled people, chronically ill or medically compromised people, or geriatric population, or pregnant women or expecting mothers, and low-income minority groups, both in urban and rural area. So these are the group of people who are at high risk. So you plan a program for them first, for these high-risk individuals, for this vulnerable population. Once the target group has been identified, the type of program should be established. And to do this, the planner begins with a set program goals and objectives. One, you have defined the target group, then your goals and objectives have to be defined. Coming to development of program goals, objective and activities. What is a goal? Goal is defined as the ultimate desire, state towards which the objectives and resources are directed. So there is only one goal and there are a number of objectives, everything coming towards that goal. So goal is usually described in terms of what is to be attained and the extent to which it is attained. That is called as goal. So coming to objectives, objectives are precise. You have to be very specific about objectives. It's either achieved or unachieved. And it is planned end point of all activities. So every small activities will have objective, which is coming towards the goal. Goal is the overall achievement which you are going to get. Okay. So your objective has to be smart. It has to be specific, measurable, attainable, relevant, and it has to be time-based. Okay. So for an example, I'll give you an example. By year 2020, more than 90% of the population age 6 to 17 years in community X will not have lost any teeth as a result of caries, and at least 40% will be caries free. That is your objective. You have to be very specific what you're going to do. So it is time bound. It is at the end of 2020. Now it has already been done. Let's change that year, 2025 or 2030. There are two types of objectives: outcome objectives. The example which I gave is an outcome objective, depending on the outcome, and process objectives. So your process objective is by year 2020, more than 90% of the population age 6 to 17 years in community X will be covered under school fluoride mouth rinse program. So I hope you understand the difference between outcome objectives and process objectives. If yes, put it up in the chat box, please. Yes or no, if you have understood what is an outcome objective and what is a process objective. Kindly put up in the chat box, yes or no. If you want me to repeat, I can repeat. I hope you are getting the point. Now coming to resource identification. Dr. Denzi, can you please look at the chat if they are responding it?
Yeah, yeah. They needed a little bit of, yeah, they needed a bit explanation, Doc.
Okay, they need an explanation again, right? Okay, fine. Now look at this example. By year 2020, will not have lost any teeth as a result of caries. So my outcome is no loss of any teeth. There will not be any tooth loss. And at least 40% will be caries free. So this is my outcome, right? This is the result I want to see. That is why it is called as outcome objective. The process objective is I'm not looking at the outcome. I just want to see by the end of 2020, the whole community will be covered with the program. I hope you are getting my point. For an example, for COVID, now the process outcome will be every person in India will be vaccinated by the end of 2022. That is a vaccine program. That is called as process objective. But my outcome objective will be by the end of 2022, there will not be any case of COVID positive infection in India. Getting my point? I hope they got the point. I hope they understood the difference between outcome objective and process objective. Perfect. Now checking for the resource, you have to identify the resources. When you are planning a program, you have to look at the resource. Now resource not doesn't mean only money. It means manpower. It means material. So you have three M's there: manpower, material, and money. So you have to look at the resources, what is available for you when you are planning to conduct a program. So you have manpower, you have money, you have material, and then you have to look at the skill. Now you can, if you want to conduct a program for, pit and fissure sealant program in Delhi, for an example. Now you cannot ask anybody to do the pit and fissure sealant. You have to have skilled dentists, right, who are trained to do pit and fissure sealant. You cannot ask a school teacher to conduct a pit and fissure sealant, to place pit and fissure sealant in a kid teeth. Okay. So skill is important, knowledge and techniques. These are important resources which you have to identify. So whether these resources are available or not available with you. Okay. So if it is the resources are most suitable, it is called as appropriateness. Extent or a degree, if you want to assess the extent and the degree of your program, it is called adequacy. If it is fulfilling the objective, it is called effectiveness. And if your outcome or the program is time and money bound, or it is associated with time and money, it is called as efficiency. Okay. Coming to identify constraints. Now you have to look into the constraints. What are the problems? What are the barriers you are going to face when you are conducting a program? So there can be different organizational policies. You have to ask a lot of permission. You have to, get permission from everybody. You have to get signed from many people when you're conducting a program. There can be resource limitations. Probably you will have very less money to conduct a program. You will have less manpower. That is your barrier. Characteristics of a community. Some people are not aware of oral health problems. So they will not identify it as a problem. They'll tell we have other problems, like they have other health issues. They don't want to get into oral health problems and all those things. That is called as characteristics of a community. You have to look what is the characteristics of a community, whether they are in, they want to go for the program, or they have problems with the oral health program which you are planning to conduct and all those things. So you have to look into the characteristics of the community. Attitude of the professional organization, that is also a barrier. Some people don't see, it is important. Some people see it is very important. So depending on their attitude, probably that can become a barrier. And lack of funding again can be a barrier. If you don't have much amount of money to conduct a program, that can become a barrier. Okay. So organization policies, the resources, limitations, attitude, characteristics, lack of funding, all these things can be a barrier for you. Okay. There can be some governmental policies which are very strict. For an example, if you want to conduct a fluoride program, if you want to go for a water fluoridation, you will not be able to do that in India or in any because there is a restrictive government policy. Okay. Inadequate public transportation system, that is one barrier. Labor shortage is another barrier. Lack of or inadequate facilities. You don't have a hospital nearby, you don't have a dental college nearby or a dental clinic nearby, that can become one barrier. And cultural and educational characteristics, that is another barrier. You have to explain, you have to convince the participants, you have to convince the head of the institution, head of that particular community or that village. So that is one important barrier which you have to look into when you are conducting a program. Okay. Best way to identify the problem is bring together a group of concerned citizens who might be involved in or affected by the project. Individuals not only can identify the constraint, but also can offer alternate strategies or solutions for meeting the goal. Okay. Next, we are coming to alternate strategies. If you have constraints, what you are going to do next? What is your plan B, basically? Okay. If plan A is not working, sufficient number of alternatives so that out of that number at least one may be considered. So for an example, if you have sufficient number, you have plan A, so you should have plan B, plan C, plan D, and all different plans. Whichever is not working, you can go to the next plan. So for an example, if you are planning for a pit and fissure sealant programs in a school or in a village in Maharashtra, so if you are not able to do pit and fissure sealant program, can you go with a fluoride rinsing program? If it is not feasible, you have a lot of constraints, can you go with the oral health awareness program? So that is called as alternate strategies. So you have to identify these alternate strategies in a very beginning, and alternatives that sound good on the surface but might have limitations. So initially you will feel this strategy is the best one, but when you are going to a ground, when you are going to the actual practical scenario, you will find a lot of limitations there. You will find a lot of constraints there. So need to consider the anticipated cost and effectiveness of each alternative again. So you have to look at various strategies. You have to also look at how much is that strategy going to cost you. How much is the resource required for that particular strategy which you are planning. So that is called as alternate strategies, identifying alternate strategies. For an example, if you're planning for a rural setup, mobile dental clinic, so that can be an alternate strategy. So if you don't have a dental college nearby that particular village, or if you don't have a dental clinic in that particular village, you can take your institutional mobile van or mobile dental clinic and go and do the treatment. So that is called as alternate strategy. So you have to look into how much resources are required, how much money is required for moving a dental van. So that is another planning you have to do. Coming to the seventh step, which is implementation strategy. There you develop what all you are going to implement. So you have to look into why, what is the effect of objective to be achieved, what activities are required to achieve the objective, who is individuals responsible for each activities, who is going to treat, who is going to look after the patients, who is going to talk to the patient or create awareness. When is going to happen? In a month I'm going to start this project. In 2 months I'm going to, or 6 months I'm going to finish the project. Then I'm going to evaluate how you are going to do this. What is your money? How much is the money you have? How much is the material? How much is the manpower? And how much is the cost estimate? So that is, you are going to implement strategy. So that is called as developing an implementation strategy. Then coming after making a strategy, now you are going to implement it. So this is a point where you are going to implement, okay, whatever strategies you have made. So implementation is putting plan into action. Now, whatever you have planned, you have made a strategy, you are going to do this. At this stage, you are going to implement. So for this, you will go with a pilot phase first, where you can do a trial and error method. Then you have a control phase where model run under regulated condition to judge its effectiveness. Then actualization phase where realistic operating conditions you are going to do. And then the implementation process, which will include the individuals, the organizations and everything, and the community. After implement, you are going to monitor what is happening, whether everything is going good, if there is any scarcity of anything. Okay, that is called as monitoring. So monitoring is a day-to-day observation, recording and reporting of the activities of the organization. So whenever you are doing a program, when you have implemented it, you need to monitor every single time or every single day. You have to record what is happening. You have to report all the activities. Okay. So according to WHO expert committee, if, after monitoring, you go with the evaluation. So according to WHO expert committee, evaluation is called as measures the degree to which objectives and targets are achieved and quality of results obtained. This is called as evaluation. It allows us to keep a track of course of ongoing activities and identifies deviation, whether you are actually doing the correct thing, whether that program is being conducted or are you deviating from the program. And in the meantime, you can fine tune the program. If there is any changes you would like to make during the process, it's called as fine tuning the program. Okay, so in this you are going to record everything what is happening. So there will be input data, financially, budgetary records, vaccines existing and all those things, equipments and supplies which are purchased. During the process data is specific activities which is carried out, and output data will be services provided. Then comes the evaluation. Now, evaluation, as I told you, it's a degree to which objectives and targets are fulfilled and quality of results are obtained. WHO says it's called as collection and analysis of information to determine the program performance. So whether your program is performing well or not, that you are going to find out, and that is a process called as evaluation. And it is also concerned with financial outcomes. So according to WHO 1972 criteria, if the object is achieved, if the objective is achieved, it is called as effectiveness. If it is associated with man, money, and manpower, then it is efficiency. If it is acceptable to the consumers and providers, it is called as appropriateness. And if it is covering the larger target population, it is called as adequate or adequacy. So if these things are happening, it is good. Your evaluation, when you're evaluating, all those things are happening, it is called as effective, it is efficient, it is appropriate, and it has to be adequate. So coming to the evaluation types, there are basically broadly classified into formative and summative. Just understand the term, you will understand what do you mean by formative and summative. Formative means examination of the activities as they are going on. So when the activities, when the program is going on, that time when you are evaluating, it is called as formatting or formative evaluation. It means during the process you are going to evaluate. And summative means at the end when everything is been done, overall evaluation, that is called as summative evaluation. Judges merit or worth of a program after it has been in operation. Did you get the point, everybody? Did you understand the difference between formative and summative evaluation? Kindly put up in the chat box yes or no. If you want me to repeat, I can do that.
Yeah, I think it's fairly understood.
Okay, fair enough, sir. Now coming to another classification, just understand the term, you will understand what it is. There are basically 5 types of evaluation: relevance, process, effectiveness, impact, and efficiency. Relevance, process, effectiveness, impact, and efficiency. What do you mean by relevance? To determine whether the program is needed or not. That is called as relevance or relevant evaluation, whether it is actually needed or not. Progress, the extent to which program implementation complies with the program plan, what you have planned and what you have implemented, whether that is in the sync, it is almost similar. So that is called as progress. Effectiveness, whether program results meet your objectives, whatever you have predetermined, that is called as effectiveness evaluation. Whether whatever objectives you have made in the beginning, whether your program is going, the results are going to meet that or not. Efficiency means attempt to relate results obtained from a specific program to resources expended to maintain the programs. Okay, so how much you have expended, how much you have given to that particular program, your money, your material, your manpower, whether the results are relating to it or not. Is it worth it? That is called as efficiency. And impact evaluation means whether the programmed intervention had any long-lasting effect on the ultimate problems that the program is intended to remedy. That is called as impact evaluation. Is your program going to give a long-lasting effect? If your fluoride rinsing program is going to, see there are no dental caries in the future also, in a new future, in a long-lasting scenario, that is called as impact evaluation. I hope you understood all the 5 types of evaluation. If yes, yes. If no, no. I can repeat again if you want me to repeat this. Just remember the term relevance, progress, effectiveness, efficiency, and impact. Kindly put up in the chat box if yes or no, if you have understood or not. Fair enough? Yeah, everybody is good with it? Okay. Now, these are the general steps. Just look at the steps of evaluation. Determine first what is to be evaluated. Establish standards and criteria. Plan a methodology to be applied. Gather information. Analyze the result. Take action and then again reevaluate. Just write these steps of evaluation in your exams. You will get the marks. And it is self-explanatory. You don't have to give any justification for this. So you have to determine what is to be evaluated, establish standards and criteria, plan the methodology to be applied, gather information, analyze the data or the result, take action, and re-evaluate. So similar like planning, evaluation is also an ongoing phase. So you have to keep doing it until you are satisfied you have met the objectives. Everything is fine. I hope you got the point. I would like to conclude with planning and evaluation. I would like to say vital role in avoiding mistakes or hidden opportunities. If you want to avoid mistakes or you want to look for hidden opportunities, plan and evaluate. If you want to forecast the future, what is going to happen, plan and evaluate. It will bridge the gap between present and the future. That is why planning and evaluation is very important. And it is a process of looking ahead. So planning is everything which you are going to do. So before that, you make a step-by-step process what you are going to do. So that is called as planning. I hope you got the point. Thank you so much. If you have any doubts, you can ask me right away.
Yes, thank you, Dr. Vineet. I think that was a very precise presentation. You're able to comprehensively cover up the planning cycle and, of course, with a very wonderful analogy of planning a trip to Goa. And of course, evaluation, which is usually the topic which students don't follow, because it just bounces over the head. I think it was very lucidly explained by you. Okay, so I
Thank you
think
so much.
we do have any questions. Anybody, please throw. Otherwise, I have a couple of questions. I think let's just see how much have you all understood. Let me just post some questions here. Okay. If your chat box is on, students, I've just posted a statement: appropriate staff available for seeing patients in the casualty. So this statement suggests which type of evaluation. Okay. Want me to make it easier, I can give you the options. It's formative, summative, implementation, or progress. Some questions for thoughts. Okay. These are just some questions to kindle your brains, I think. Let's just see. Okay. Okay, let me just give the options, I think. Yeah. Let's see how many of you can distinguish between that. Okay. Mansi says implementation. Answer formative. A lot of this depends on how you've understood the topic today.
If they can unmute themselves and I'll ask them a question. If they can,
Yeah,
they can
yes,
unmute themselves and then say. I imagine you are planning to go to Goa and the tickets are very expensive. The flight tickets are very expensive. And then you decided you book a car and 5 of your friends. What stage will it come to? This flow chart, at what point it will come to, when you have planned of going to Goa, when the tickets are very expensive, and then you realize it's going to cost you so much, and then you plan to go by a car. You pick up a Zoom car or whatever, and you have planned 5 of your friends will come together. So anybody, can you tell me at which point or which step of this flow chart, which step of this planning process will you
Yes, students, you can go ahead and unmute yourselves. You have an answer in the chat box. Saurabh says determining priorities. Ruchika says alternative strategy.
Alternate strategy. Your alternate strategy was because it's expensive and you have planned for something else. Now, determining priorities, I can give you another example. Or okay, fine. I'll give you another question. You find out.
Dr. Vineet, your voice is slightly muzzled.
Yeah. Is it fine now?
Yeah, now it's better. Please continue.
Yes. Now, another thing. Now that is called as okay. Somebody, the one who has told identify alternate strategy is the correct answer for this. Now the next one is determining the priorities. Okay. Now I want to go to Goa and I want to go for adventurous trip. I don't want to waste money on living or eating or anything. I just want to do some adventure, something adventure in Goa. I want to go for paragliding or I'm going to for scuba diving or something. That is called as determining priorities. So I think Saurav, you got the answer. Determining priorities means you have to understand if the community is suffering with oral cancer and dental caries and dental fluorosis, what are you going to plan your program for first? So your planning should be if there is a lot of people or the percentage of the prevalence of oral cancer more in that particular community, you look for oral cancer. So you have to make a program, you have to devise a program to control oral cancer first, or you have to go for the program where you treat oral cancer and then everything later. So that is called as determining priorities. I hope Saurav got the point. Determining priority means.
Yes, sir.
Okay, that's all. Anything else? Anybody has any other question or anything?
Any other questions? Yes, Sakshi.
So I wanted to ask, like we get this question a lot, like to evaluate the health education program. Is it something related to this only, or how should we answer that question? Like to plan and evaluate a health education program.
Plan and evaluate health.
Program.
Could you repeat your question, Sakshi?
So I have seen last any question. There was a question that was about planning and evaluating a health education program.
Health educational program.
Yes.
Okay. Yes. So in that, see, whenever the question comes like that, start with the definition of what is planning, what are the different steps of planning, and evaluation and the types of evaluation. Okay. So health educational planning means, a program means, you're not going to do any kind of a treatment there. You are just educating, creating awareness regarding that. So even for creating awareness or developing a educational program, you will need all these things, right? You will need resources. You will have to determine the priorities, what kind of educational program you are going to conduct, whether you are going to educate them for dental caries, or whether you are going to educate them for tobacco chewing, or whether you are going to educate them for other health issues and all those things. So you have to set the priorities, you have to determine the priorities. In that also, you have to develop program, goals, objectives, and activities. What you are planning to do is, you have to look into the constraint, you have to implement, provide the implementation strategy. So whenever a question comes like that, develop a program, or planning and evaluation of a health educational program, you have to follow the same step. You write the definition in their exams, you write the different steps of your educational process, okay, of your planning process pertaining to your health educational program, and then you put up a word on evaluation and different types of evaluation. That is how you are supposed to write.
Oh.
I hope you got the point, Dr. Sakshi.
Thank you, sir.
Yeah, thank you.
Yes, sir.
Yes, students. So I think for the postgraduates, especially for the problem solving exercises, is fundamentally based on the planning cycle and how would you approach. So even in your YOC, which is how the examiner would be assessing based on what kind of approach. So essentially, this should be in the back of your mind, and how you should be tackling the problem, like Dr. Vineet explained in various steps. So please do follow this. Let this be in the back of your mind to identify, and then to develop and eventually strategize. So that would be the key to problem solving.
Yes, exactly, sir.
Yeah,
because in problem solving, when they create a problem, when they write up a problem, you have to be very vigilant in understanding that, because in one problem itself, there can be a 3-4 dental issues. Okay. So you have to identify, for an example, the DMFT, they will give a DMFT score of 3 or 4. And at the end, they will write, there is a habit of tobacco chewing in the community. Now you have to be very careful with that, because there are 2 problems here now. It's not only dental caries, it's a tobacco chewing habit also. So you have to create a program in which you can implement both the things together. Or you look at the need assessment. You are going for a need assessment, right? You are going to look at what is provided, how to obtain that data. So in that you will write it down, whether you are going to find out the prevalence of oral cancer or pre-malignant lesions. So that is very important. So all these steps will help you in problem solving also. And problem solving doesn't mean only designing a program. You have to look at the resources. You have to look at the manpower required. You have to look at the money amount or how much, the funds required for that particular. So all these things all together will come under. So that under writing a program, or when you are planning a program. So you have to be very careful. All these things, all these steps of a planning process is very important for final year BDS, also for writing questions, and for PGs when you are doing problem solving. And you have to be very, very vigilant and very, very keen in looking at the thing. What is the exact problem? You have to identify the problem very importantly.
Yes, Dr. Deepak had a question. Go ahead, Deepak.
Very good evening, sir. I just wanted to ask, sir, we do have we categorize the objective as primary and secondary objectives also. So the outcome and process objective comes under primary objectives.
Yes. No. See, what happens, outcome and process is another classification of objectives. Now, there are various type of objectives. Primary, secondary means, primary means the first objective which is of your concern, which you are going to do. For an example, I want to reduce oral cancer after, the prevalence or the new prevalence of oral cancer from 50%, it will be reduced to 10% at the end of 10 years. That is my primary outcome, primary objective. Secondary objective will be probably, the incidence of or the prevalence of dental care is also included in it. That is my secondary objective. Getting my point? So you have two types, primary and secondary objectives. Now, outcome and processes are different. It can be involved both in primary as well as secondary. Outcome and process objectives are made for both primary as well as secondary objectives. So in a primary objectives, your outcome objective will be, reduction in the number of oral cancers after 10 years. Okay. And your process objective will be your program. You want to conduct that program for everybody in that village is your process objective. Getting my point?
Yes, sir.
So you are creating a no tobacco awareness program for controlling oral cancer. So your objective is to conduct that program for everybody in that village. That is called as a process objective. But you want to reduce the prevalence of oral cancer after 10 years, that becomes your outcome objective.
But so there can be a situation where a outcome objective becomes a primary and the secondary becomes the process.
Yes. Of course, it can be. It depends on what is your plan, how you are going to see it. Now, primary objective can be reduction of dental caries to 50% after 10 years. That is your outcome objective. Your secondary objective will be implementation of pit and feature sealant program in that particular village, school-going children of that particular village. That is your process objective. So your secondary objective can become your process objective. Your primary objective can become your outcome objective.
Okay, sir. Thank you.
Welcome.
Okay. So any more questions? Anybody else? Please do let us know before we can quickly wrap up the session for today. So, yes, Deepak. Yes, Dr. Deepak. Wanted to ask something?
No, sir, it was just by mistake. Sorry, sir.
Okay, that's okay. All right, so I think that brings us to the end of today's session. I think it was a very, very enriching and a very interactive session. All because I think Dr. Vineet very elaborately explained this concept. because it's again fundamental for the understanding for most of dental public health programs. So for the undergraduates, again, I think you've all got what you're looking for. How do you start writing the answers? It's usually often asked as a main question. And again, types of evaluation, planning cycle. These are all short notes and short essays, which routinely figure out and come out in your papers, whichever university you belong to. So thank you all so much. Thank you, Dr. Vineet, for doing this session. I think we're really happy to have you on board, and thank you for sharing your knowledge and expertise. The rest of the students, of course, you can always send us any queries if you want. Like I mentioned, you can also join in the group by clicking on the link which I've posted in the chat box. You'll continue to receive all the important notifications, and we shall also be sharing the presentation of today's session and subsequent sessions regularly, so that you might go back and quickly revise for this. So thank you so much, Dr. Vineet, for taking time and doing this session for us. Thank you.
Thank you so much, Dr. Denzi, and thank you everybody, all the participants, all the delegates who have been available here. Best wishes for your exams, and thank you so much, Dr. Denzi, for inviting me, and it was really wonderful to interact. And thank you for interacting, guys, because in most of the sessions, people don't interact, they don't ask questions, and I'm happy that you guys, and you are here to ask questions, so you can ask any questions if you want. You can share my number also, sir, if you really,
yes,
if you really want to know something about any topic of public health dentistry or anything. Thank you so much, Denzi, sir,
sure.
for
Thank you.
inviting me. Okay, bye, guys. Thank you so much.